Right, so metabolism is the way that our brains and bodies stay alive and adapt to the environment. So if you focus on the brain, the idea is to match kind of the energy that we have to the demands that we have, namely sensory input, mental load, focusing, exercise, etc. So there's been research in the past wondering about migraine as a reaction, a protective reaction of the brain to a mismatch between maybe excessive demands to insufficient energy. And that's what we think about when I think about metabolism. Now, key aspects of this, right, go beyond only the brain. You have to look at the whole body. So for example, maintenance of sugar, of blood sugar levels is key. One other factor that is very important is sensory overload. So for example, excessive lights or sounds. Air pollution is also something that influences our metabolism. And interestingly, triggers that will lead to a migraine attack, almost all of them coalesce to increase what's something called oxidative stress, which is the result of this kind of excessive spending in energy or higher demands. The only trigger that doesn't really increase oxidative stress is neck pain, for example, but all the rest coalesces there. So now we know thanks to the CGRP era, which is the key advance in neurology for the past, in migraine for the past decade, the end of the cascade. You know that there's an inflammation triggering the attack. But what does trigger this cascade? Could that be metabolic factors? We also know that some people do not respond very well to CGRP blockade. So could that be maybe because of metabolic factors? If you look at certain people who are very refractory to treatments, well, they've had what? They are either obese, some of them have very significant adverse childhood events that also increase the metabolic load in future adverse events. Some have vascular disorders that also cause problems. So one could wonder, is that a path to treatment maybe?